Today is Wednesday, February 24th. It's about 8 a.m. here. Um, I'm just getting out of bed per usual, but I just wanted to give a quick update as to where things are today. So when you left me last time, we had done our egg retrieval and they had gotten 5 eggs, four of which were able to fertilize successfully. We were waiting until yesterday to get another update as to where they were in the growing phase, I guess I should say. So we got a call late yesterday evening that out of the five, three of them continued to grow and were able to make it to be frozen. They've been biopsied, and those samples have been sent off to the lab to be tested, which can take 10 to 14 days. Um, so right now we are, celebrating the fact that we have three babies on ice. Um, we don't foresee them coming back with any abnormalities genetically. To my knowledge, there isn't really anything that runs on my side of the family that we would need to be worried about. My husband's side of the family, the only thing that he's aware of is the sickle cell trait. Um, but we're not really thinking that anything is going to come back abnormal. So we're enjoying the moment of knowing that we have three babies on ice right now. We'll get those results back in 10 to 14 days. After that, I am slated to have my transfer on March 23rd. Um, excuse me. We don't know yet if she's only going to transfer one or if she's going to do two. My husband's really pushing for two just to strengthen the chances of us having twins. I've already warned him there's a possibility that those eggs could split. We could end up with three, we could end up with four. He's all for it. I'm like, yeah, it's easier said than done. Like, once we're in that, what are we going to do with four kids? But um, he's really wanting her to do two. And I did tell him, it's kind of up to the clinic. Like, not all clinics will do whatever amount that you want. Some of them will only do one if you're under a certain age, things like that. I'm thinking she will do two, but we'll see on March 23rd. Tonight, I am starting Lupron injections. They have to be done at the same time every night. So I had to get a prescription filled through CVS Specialty. They have not been able to get that order out to me yet because they were waiting on authorizations from the doctor. So my clinic actually gave me like a 7-day supply of the injections just to hold me over until all of that medication comes in. So those will start tonight. Next week, I'll be starting what they call my Cryo Calendar, where I'll be taking something called Estrace every day. Um, at some point, I'll start taking prednisone and doxycycline. I'll have my baseline ultrasound next week, and then the dreaded progesterone um, injections are going to start as well. So out of all of the stimulation medication, all the needles 2-3 times a day, progesterone is my least favorite thing. It is an intramuscular injection, so it has to go directly into the muscle. So it has a really thick, really long needle. And when we did those during my last cycle, we did them like in my backside, and it hurt really, really bad. So I can't imagine it hurting any less now. Um, Especially with me being so much smaller, I'm just thinking that the pain is going to be 10 times worse. I'm going to ask my nurse if I can use like a numbing, like a lidocaine ointment in that area before injecting. I've also seen in one of my IVF Facebook groups that women are using auto injectors just to make it easier. I guess it's like a pen and you just hit the button and it auto injects the needle, which I don't do the injections myself anyway. Those specifically I have my husband do, but there were a few times where I was bleeding after the injection and it's just horrible. So I'm gonna see if they will allow me to use numbing cream, which I hope they do and I hope it works. Um, but that's really it. They still have me taking the thyroid medication. Again, my thyroid level is not high. It's just on the higher end of normal. And that's something that they want to control before and during pregnancy. So they still have me taking that. They had me on metformin twice a day. But I told them yesterday, like, I cannot take the metformin anymore. It makes me really sick. You guys know when I talked about breaking my finger, I had passed out after having the metformin. It makes me not be able to eat like 2 bites of food, and I feel like I'm sick. So she took me off of it and gave me something else to try that I'm going to do right after I eat. It has to be done twice a day. It's called, I don't know, Avasitol. It comes in a box like this. I have to actually go online and order it because she only gave me some samples that they had, but it is a powder. So there's 2 packs in here, one for in the morning, one for in the evening. It says mix it with any food or non-carbonated hot or cold beverage twice a day. And it basically does the same thing that the metformin was to do. It says it promotes insulin sensitivity, promotes healthy ovarian function and egg quality, supports normal hormone levels, things like that. So I hope it doesn't have a taste because I'm not really keen of things with funny taste, but we're going to start that today too. I'll be back a little bit later for you guys to see how the Lupron injection goes, so stay tuned. Good morning, guys. So today is Tuesday, March 2nd. Today I have what they're calling a baseline ultrasound and lab work with my clinic in preparation for my frozen embryo transfer. It's about 8 a.m. My appointment's at 11, so I'm just relaxing, having some coffee. And then I'm going to have like a bottle of water or a Gatorade before I leave because they always want me to leave a urine sample. I don't know exactly what they're looking for on the ultrasound or in the labs today, so I am going to ask that when I get there. I've been doing the Lupron injections every night at 7:50 p.m. I think that I'm slated to continue those for like another 2 weeks. The needle on those is very, very tiny, but for some reason, my husband kind of has to like jab it like he would be throwing a dart or something in order for it to go through my skin. I don't know if it's just my skin, like maybe I'm not hydrated enough or what, but that tiny, tiny needle does not want to go in at all. So he has to do that very quick. But it doesn't really hurt at all. There's never any blood or anything afterwards. So yeah, I'm doing that every night. We stopped the metformin. I'm taking the powdered form of the other supplement that they gave me, and my appetite has come back 100%. I think immediately after I stopped taking the metformin, I was able to start eating more. So I have been I've been trying to force myself to eat like every 2 hours. Just because I wasn't really eating much at all. And honestly, I am trying to gain like 5 pounds. So I've been trying to eat every 2 hours. That has been going well. For the most part, I am just eating a lot of protein and vegetables. There have been a couple times where I've had some potatoes and things like that, but like I said, I'm trying to gain 5 pounds. So yeah, I'm going in for the ultrasound and lab work in just a little bit. And then I received a new order of medications for the things that I'm going to start once I start what they call my Cryo Calendar, which is going to start, I believe, on the 4th. That's where I'll introduce the estrase pills. I'll continue the Lupron. And then in about 2 weeks, I'll start the progesterone injections. They'll have me taking doxycycline and then prednisone as well, all in preparation for my embryo transfer on the 23rd. Now my egg retrieval was the 17th of February, I believe. And then on the 23rd, I believe, is when the embryologist called to say that, we had 3 embryos make it to freeze and the samples were going to be sent off for testing. She did say it can take 10 to 14 days to get results. We haven't heard anything yet. I was expecting the actual lab where the samples were sent to call me once they received them because we do have to pay them, but I haven't heard anything yet. So I don't know if they wait until after testing, or, you know, if my embryos hadn't even been sent yet. I don't know. Those are questions I'm going to ask when I get into the doctor today. Um, but we are just really anxious for those results and praying that all three of those embryos test normal so that we can go ahead and transfer these babies and, you know, hopefully be announcing a pregnancy in April. Um, so yeah, I'm going to go ahead and start getting myself together for the appointment, and then I will check back in with you guys in just a minute. All right, guys. So I just left my appointment. It was pretty quick. They did some lab work just to check like some of my levels. As I had mentioned before, I had been taking like a thyroid medication, so they checked that level as well to see if I need to continue that medicine. They did the ultrasound to measure like my uterine lining and to look at my ovaries and everything like that. She mentioned that there was some fluid in my uterus, which she said just could have been from the procedure that I had done during egg retrieval, but they're going to keep an eye on it. She also did a swab just to check for any bacteria or anything that could cause any issues with the transfer. So she said as long as that comes back fine, then my transfer will proceed as normal. If for any reason they find any bacteria or yeast or whatever, they'll just put me on medication to clear it up before transfer. The only real concern right now is that I have not started my period yet. And with that, it could alter my actual transfer date. So typically after you have egg retrieval, you're expected to have your period no later than like a week later. I had like some spotting the first couple of days after retrieval, but that's normal with an egg retrieval. So by now I should have started a cycle. They said at this appointment I technically should have already been on my period. So they just want me to watch it over the next couple of days. She said potentially I may start it in the next couple of days, just, you know, based on them going up in there today messing with stuff. It may trigger it to start. But once it starts, I should call them and let them know, because it could just push things off by a couple days. Like I'm supposed to start a few more medications in 2 days, like the estrace to help thicken my lining, continuing the Lupron injections, things like that. So it could just push things off by a couple days. It may push transfer off by a couple days. At this point, nothing's being canceled. It just may be delayed by a few days based off of what my body is doing. So yeah, those were the really only things that happened today. I talked to her about the progesterone injections and how uncomfortable they are. She called in a prescription numbing patch for me to see if my insurance will cover it. She said to just put that on about 30 minutes before doing the injection and I won't feel anything. Of course, she said it doesn't numb the muscle, so I will probably still have some pain after doing those injections, which I can just treat with like a heating pad. So hopefully we can do that. But she did say if, you know, insurance doesn't cover it or I don't want to pay for it, just use like a lidocaine cream, which I already ordered from Amazon. So I'm hoping even if insurance doesn't cover the patches that they're not that expensive and I can just get them anyway, because I don't want to feel that injection. What else? That's really it right now. Like I said, I'm set to start what they call my Cryo Calendar in 2 days. I'm due back for another ultrasound on the 16th. So, excuse me. From here, I'll probably give you guys another update in a couple days just on the meds and everything. And then we'll do another video once my next ultrasound comes and when we get the test results from the embryo testing. I'll come back and give you guys an update about that. So until then, see you guys later. Be safe.